Good morning. Thank you for joining us today. This is the Rock County Public Health Department media briefing for July 22nd, 2021. This briefing is being streamed live on the Rock County Public Health Department Facebook page, and it will also be uploaded to our YouTube page once the briefing ends. We always start with some updates and some information from the Rock County Public Health Department, and then we will turn it over to our media partners for some question and answers. So I will start now by turning it over to Nick Zupan. He's an epidemiologist here at the Rock County Public Health Department, and he has some data updates for us.
All right, thanks, Jessica. So in terms of our case activity, we're still seeing pretty low numbers. Right now, over the course of the pandemic, we've had 16,521 Rock County residents test positive for COVID-19, but we are seeing a slight increase in terms of our average numbers of case activity. So right now we're averaging about 6 new cases per day over the last week. This is a little bit higher than we had seen in the past few weeks. Not overly concerning at this point, but it is something that we're monitoring. We're estimating that there are about 100 active cases in the community right now, and there have been 184 deaths due to COVID-19. Most recently, we've had 5 patients in the hospital. So again, this is a slight increase that we've seen over the past few weeks, but not overwhelming numbers at this point. In terms of our vaccination levels, we have just over 50% of Rock County residents having gotten at least 1 dose of the COVID-19 vaccine, and 47.6% of the population have completed that vaccine series. So the other piece of information that I did want to share on the call today is that there have been 3 instances of the Delta variant being identified in Rock County. So these individuals tested positive for COVID-19 in the month of June, and then the genetic sequencing information was just recently made available to the health department. It's likely that we could be seeing some of the increase locally just due to the Delta variant strain. We know that this variant is more contagious and can lead to more cases, potentially could lead to more severe illness in certain individuals who are at higher risk for severe illness. So we just wanted to make everyone aware that the Delta variant has been identified in Rock County. We'll be monitoring the situation moving forward to see if there are additional cases that are identified. Not every person who tests positive has their specimen submitted to the state lab for genetic sequencing, so we don't know the full extent of how many Delta cases there are, but it's reasonable to assume that there are more than those 3 that have been identified so far. The bottom line here is that with the vaccine does provide protection against the Delta variant. So it's really important that people continue to get vaccinated. If you are unvaccinated, we're seeing most of our severe cases, the hospitalized patients, being individuals who have not received that vaccine. So even if the Delta variant is circulating in Rock County, the vaccine will provide protection. So with that, I'll turn it back over to you, Jessica.
Thank you, Nick. Next, I'm going to go to Seth Longcar. He is our Administrative Services Supervisor, and he will be giving us some additional information.
Great. Thank you, Jessica. Today, we want to talk about more misinformation. During the COVID-19 pandemic, people have been exposed to an abundance of information from a large number of sources. Amid all this information, many people have been exposed to health misinformation. By misinformation, we mean information that is false, inaccurate, or misleading according to the best available evidence at the time. Misinformation has caused confusion and led people to decline COVID-19 vaccines, reject public health measures such as masking and physical distancing, and use unproven treatments. People are especially vulnerable to misinformation in times of uncertainty. It is one way our brain helps us process novel challenges by simplifying the world around us. For example, studies have shown that belief in conspiracy theories may help people who feel bombarded by too much information reduce the complexity of what they are receiving. People are especially vulnerable to this effect when feeling powerless or overwhelmed, which certainly applies to the last year we all experienced. Although health misinformation is not a recent phenomenon, in recent years it has spread at unprecedented speed and scale, especially online. But together, we have the power to build a healthier information environment where we make more informed decisions about our health and the health of our loved ones and communities. Here are a few things you can personally do to fight misinformation. First, learn how to identify and avoid sharing misinformation. Many of us share misinformation without meaning to do so. We are trying to inform others and don't realize the information is false. Social media feeds, blogs, forums, and group chats allow us to follow and interact with a variety of people, but not every post can be considered reliable. Verify the accuracy of what you learn by checking with trustworthy and credible sources. A few trusted resources include the CDC, Wisconsin DHS, or the FDA. You can also get answers to your questions from qualified professionals on sites such as dearpandemic.org or health-desk.org. And a good rule of thumb is if you're not sure the source, please do not share. Second, talk about misinformation with your family and friends. If someone you care about has misperceptions, you might be able to make inroads by first seeking to understand versus passing judgment. Listen with empathy, establish common ground, ask questions, provide alternative explanations and sources of information. Stay calm and don't expect success from just one conversation, as this is a process. Third, to take this one step further, we can all work to address health misinformation in our community by engaging with community organizations to share strategies against misinformation. For example, you might want to invite a local health professional to your school, your church, or any other local group that's important to you to talk about COVID-19 vaccine facts or similar topics. We can help provide you with resources if you are interested in arranging something like this. For those that would like more information about fighting misinformation, we can also share publications from a number of trusted sources, including the Surgeon General on request. Preventing and addressing health misinformation is a major priority for the Surgeon General, and they have created a helpful guide. Please don't hesitate to ask questions or reach out after the briefing. So we have a few other updates for you, and then we can take some questions. Back to you, Jessica.
Thank you, Seth. I will now turn it over to Michael Niles. Michael is one of our public health specialists. Go ahead, Michael.
Thanks, Jessica. So it's just some general vaccination updates for you all. So while the COVID-19 testing site at Black Hawk Technical College ends today, July 22nd, the community-based vaccine clinic at BTC will continue. So after announcing the continuation of the vaccine site at BTC last week, we have received a number of questions regarding the reasoning. The clinic is operated by DHS in partnership with AMI, so I'd like to share what DHS passed along to us at Rock County Public Health. DHS made the call to extend vaccination efforts with their vendor AMI Expeditionary Healthcare through the summer to continue to provide vaccination opportunities through the state. This was not in response to the Delta variant, but to capture the opportunity to vaccinate adolescents and families before the fall school year begins. The Rock County Public Health Department agrees this makes perfect sense, as vaccination is still our most valuable tool in the fight against the COVID-19 pandemic. We'll now transition to upcoming vaccination clinics. There are still many opportunities in Rock County to get the COVID-19 vaccine. Given the increase in prevalence of the Delta variant throughout the country, it's especially crucial to get vaccinated, as the vaccines have proven to be effective against the Delta variant. We encourage everyone who is eligible to get vaccinated. For those interested, we have some upcoming vaccination clinics. Today, Thursday, July 22nd, Marshall Middle School in Janesville will be offering free vaccinations from 2 p.m. to 5 p.m. In Beloit, vaccinations are being offered at 2 elementary schools over the coming weeks. At Merrill Elementary on Wednesday, July 28th from 11 a.m. to 1 p.m. and at Hackett Elementary on Wednesday, August 4th from 11 a.m. to 1 p.m. For those that are homebound, we have increased access to professionals who will come to your home to provide a vaccination. Caretakers for those who are homebound may also be vaccinated at the same time if they wish. Please call 608-352-6727 to schedule. To find additional details and more vaccine clinic opportunities, visit rockcountyshot.com. Rockcountyshot.com is a frequently updated resource targeted at Rock County residents to help match residents to vaccines. Please visit rockcountyshot.com/locations for more information. And back to you, Jessica.
Thank you, Michael. We will now turn it over to our media partners for some questions. And it looks like today our only participant is Austin Montgomery from Beloit Daily News. So Austin, thank you for joining us. We will give you the ability to mute and unmute yourself, and you can go ahead and ask any questions that you have.
Hi guys, thanks for doing this. Just wanted to take some time and kind of touch base on a few of the things that Seth had addressed about misinformation. Just wanted to see if there were any things that have been identified locally as some of the most common misinformation things that have been either been sharing around, or is this just kind of due in response to some of the just the national conversation with misinformation, but looking to see if there was anything specific locally that prompted that. Thanks.
I can answer that. This is Jessica. So it's in response to both national and local misinformation that's circulating. We are seeing a lot of the same things that have been circulating nationally here locally. It has been a problem here and throughout the country, and it's something that we've been addressing throughout the pandemic. We're continuing to address, and we're working with our partners as well on that. So it's something that's ongoing. We are just trying to, I guess, bring more awareness to the subject and help educate people on how to spot that misinformation and give them some tools to combat that misinformation on their own. But certainly the Surgeon General advisory that recently came out prompted us to make this a topic for our media briefing.
And I know Nick has given us this information before, but just looking to check in, I don't know if there's something that we can just follow up on after the call, but I was wondering if there were any updates to the number of breakthrough cases here in Rock County. I know that number was quite small when we last reported it, I think about a month and a half or 2 months ago, but just wanted to check in on that to see if Nick had those numbers available. Thanks.
Sure, yeah, I can provide that information. So since the vaccine has been rolled out, we have seen 45 breakthrough cases. So it's a very low number when we look at kind of the rate of how many people have been fully immunized versus how many of those cases are among people who have been fully vaccinated. We're seeing that rates as slightly lower than some of the state and national averages in terms of breakthrough cases. And that's something that we do continue to monitor and make sure that we're aware of any breakthrough cases. And in some instances, those are the cases that they have their genetic or the specimens sent for genetic sequencing to determine if those cases are variant strains of the virus.
And Nick, I think this is another question for you, but not sure if anybody else wants to take a stab at it. I know at the beginning of the pandemic in 2020, you guys had done a lot of modeling to try and figure out just kind of where the county was headed. Are you guys undertaking anything similar to that right now in terms of just trying to figure out what the fall might look like as back to school comes, and also we head into the winter time when more people are indoors and things like that? Just wanted to see kind of where you guys were at for any modeling just for the future the next quarter or so.
In terms of the modeling that we had done initially, I think we had attempted to give a long-term kind of view of what the pandemic could lead to in terms of case activity and hospitalizations, and found that any attempt to really predict beyond a few weeks of where we are today was very difficult and pretty variable in terms of its accuracy. We have done some modeling more recently with respect to kind of case activity in the next few weeks, and we'll be working on updating those figures, but a lot of unknowns are out there right now in terms of the Delta variant spread and how pervasive that could become. And then also, we're still monitoring closely whether or not those who are under 12 will be able to be vaccinated vaccinated in the near future, and that will definitely change how case activity could play out in the coming months. So any kind of modeling that we do, we try to limit it to at least, or at most 3 weeks, just because of all the unknowns that are out there.
And would you be able to kind of detail what kind of that picture is looking like for the next 3 weeks, if you can speak to that? Thanks.
Sure. Right now, because the case activity is still relatively low, the models are showing that in the next 3 weeks there isn't going to be overwhelming spread of the disease. So it's not showing anything of note at this point. It's something that we'll continue keeping track of. And if we start to see the rate of increase in terms of our daily numbers of positive cases increase, then that will also be an indication that there could be ongoing increase in the coming weeks. And so right now things aren't very interesting in terms of the models that we have, but that could change pretty quickly with the Delta variant that's circulating.
And I know obviously the health department is kind of at a limit to how much data they're able to get related to the Delta variant, just because, like you said, all the genetic testing isn't run for every positive case. It's only a random sampling that gets processed through the state. But is there any sort of figures or any sort of kind of number that the county is looking at in terms of how pervasive the Delta variant might be right now? I know obviously there's probably more than those handful of cases you had mentioned already, but just wanted to see kind of how the county was handling that in terms of just trying to figure out how prevalent the Delta variant is in Rock County. Thanks.
Sure. Yeah, and as you mentioned, it's hard for us to quantify how many true cases of the Delta variant there are in the community because of the limitations that we have in genetic sequencing of anyone who tests positive. So there are only a handful of people whose specimens get sent for genetic testing of those who test positive. We would have to take a look at some of the kind of estimates that are out there for maybe nationwide in terms of what research has been done to estimate how many true cases of a variant there are based on how many have been identified from the genetic sequencing. The genetic sequencing isn't done in kind of a random sampling type of methodology. It's more based on some criteria in terms of if the person was severely ill, if they were vaccinated, if they had travel history. So again, you're not getting a random sample of the total population and being able to extrapolate that to the total population. So it becomes a little bit more difficult to estimate. I think the bottom line that people can take away from this is that the Delta variant is here in Rock County, that the vaccine does protect people from the Delta variant, especially from becoming severely ill. And we really need people to become vaccinated. As there are more Delta cases that are identified through the genetic sequencing, we'll keep the community aware of those numbers. But for now, we just really need people to get vaccinated, and that's going to be our way of preventing the spread throughout the community.
I appreciate it. I don't think I have any more questions, but just want to say thanks for putting this out here, as always, every 2 weeks. With that, I don't have anything else. Thanks, guys.
Great. Thank you, Austin. Thanks for joining us today. So that will conclude today's media briefing. Thank you, everyone who has been watching this on our Facebook Live. The recording will be available on our Facebook page and our YouTube channel after this is concluded. And I just want to say, have a great day. Stay safe, stay healthy, and we'll see you in another 2 weeks.